How do you de-stress? This is another common question that will be asked. As you know, as a doctor, very often you'll be working for long hours on call, working in a very high intensity environment, working night shifts. It's therefore important that you know when to de-stress and how to avoid burning out. This is currently one of the major problems within the NHS, as more doctors are working longer hours with poorer staffing levels, so the risk of burnout is very high. In this question, you can divide it into three ways. How do you prevent getting stressed in the first place? What would you do on a regular basis to de-stress? And what would you do immediately when stress starts to come up? So first of all, prevention of stress is important. Prevention is always better than cure in medicine. If you're able to prevent getting stressed, then you won't have to deal with it because it doesn't come up. So this comes down to having good organisation and time management skills. This might mean having a piece of paper or a whiteboard and write down the tasks to prioritise, making sure that you're not forgetting anything. Some people will have a calendar or a time block for work to ensure that there is enough time to complete the task over a period of time rather than leaving everything to the last minute, and to time block times to relax and do things that you enjoy. The second thing, it is important to ensure that you have a few activities that you enjoy doing, such as hobbies at times when you're not working. This may include talking to your friends to express your thoughts and emotions, doing sports activities, or playing a musical instrument, and the list goes on. It is, however, important to state why you like to do these activities. For example, it might be to learn a new skill, to refocus your mind, to try new things, meeting new people, etc. The third thing, what if you feel stressed in a current moment of time? What do you do? One example might be a few minutes before an exam or a public speaking event, or getting lost. What would you do? There are certain activities that you can do. So these examples include certain things like breathing exercises or breathing techniques, listening to calming music, and knowing your limit and asking for help. Be prepared. You might be asked to give one example where you dealt with a stressful event. What did you do to overcome this, and what did you learn to do next time if it happens again?